How are nursing associations uniquely positioned to influence policy at local, state, regional, and national levels? At all levels, these organizations can mobilize members and educate them to choose or join a common movement. They can advocate and lobby. In fact, if the association is granted tax exemptions, then there is a covenant with the federal government that has an expectation of political action or investment. At local and state levels, grassroots efforts are effective to influence policy change. Health systems and nursing boards can educate and set practice guidelines and advocate for change. Regionally, nursing organizations can align and coalesce, which is how state compact agreements are formed. Nationally, the American Nurses Association Political Action Group, for example, has formidable membership, united under one voice, and considerable funds that are used to lobby federal health policy. Mason et al., 2021, and Matthews, 2012. The magnitude of that power is impressive. A unique challenge faced by these organizations when framing policy agenda is choosing a point of view. To be effective, nurse associations need to present a common voice when framing policy that shows complete membership buy-in. Therein lies the challenge, as the best expectation is majority rule when any group of individuals need to agree on a topic. Nurses tend to approach policy topics from a practical perspective and with an altruistic motive. But we are only human and therefore emotionally tied to our beliefs. Politicians use partisan tactics to emotionally manipulate their constituents. To play the policy game, nurse organizations need to manipulate emotional messages and frame policy messages to garner support. In Mason et al., 2021, the authors mention the vital importance of having a thread of DEI throughout our work, end quote, page 541. While this is true, the current political climate is such that DEI verbiage is guaranteed to offend specific Americans and politicians. Clever framing is required to engage those individuals and factions. Next, the National League of Nursing describes its 2025-2026 policy on diversity and inclusion as 1. To promote funding and retention policies to diversify the nursing workforce. 2. To promote education in evidence-based practice and address social determinants of health with cultural congruence. 3. To support policies that address the needs of all humans, families, and communities. 4. To promote inclusivity in education and care environments. 5. To advocate for collaboration with other nurse organizations. To support common goals under a common voice. The National League of Nursing website, 2026. As professional nurses, to support, we can 1. Check our personal biases for or against DEI and destigmatize the term once again. 2. Nurses can take time to research the benefits and consequences of DEI in healthcare, with special emphasis on patient outcomes. 3. Nurses can seek out like-minded people and local organizations to ignite the fire that comes from a sense of community with common goals. 4, we can attend meetings and join activities that advocate for policy change, like lobbying politicians. 5, nurses can identify stakeholders and address them with messages framed to engage their support. 6, finally, nurses can advocate for DEI in communities, at work, and higher levels. Thank you for watching my presentation.